Before we ever assist a resident with their medication, we must first have a physician's order. A physician's order is required for all medications, including over-the-counter medications. There are several types of physician orders. We'll begin with talking about routine, or sometimes called continuous physician orders. A routine order is for a medication that the resident will receive on a regular basis. For example, give 40 milligrams of Lasix by mouth every morning would be an example of a routine order. This is a medication that a resident is going to receive every single day at a specific time. You may also have a one-time order. This is a medication that the resident will not receive every day, but rather receive one single dose of that medication. Sometimes a resident will require a medication to be given right away. This is known as a stat order and one that must be acted upon immediately. Residents may also have PRN, pro re nata, or as needed orders. This is a medication that the resident will only take as needed. An example of a PRN medication order might be something for pain, like acetaminophen. They may also have an as needed order for anxiety. There are different ways of receiving a physician's order. For example, a family member may take a resident to the physician's appointment and come back to your community with a written prescription order. You may also have a whole new set of orders delivered to you upon admission of the resident into your community. Often in an assisted living community, a physician may send the orders by fax. Some doctors may try to give an order verbally in person or over the telephone. While some states may allow this type of order, it is always best to obtain a written physician's order. Whenever obtaining a physician's order, it is critically important the order is complete. Let's talk about some of the important components in a physician's order. A physician's order must contain the following: the name of the resident, both first and last, spelled correctly. The name of the drug. The physician may list the drug either as a trade or generic name. For example, the physician may write Lasix, or the physician may write furosemide. If you are ever confused about a trade or generic name conversion, always check with your pharmacist. The physician's order will also include the strength of the drug, as well as the dose of the drug to be given and route of delivery. Additionally, the frequency of the dosing will appear on the physician's order: daily, twice a day, etc. So an example of an order would be Lasix 40 milligrams. Give one tablet by mouth every morning. Physician orders become a permanent part of the resident's record. So you will want to familiarize yourself where physician orders are kept within your community. Typically, they are filed in each resident's individual chart in chronological order, with the oldest order on the bottom and the newest order on top. Sometimes physician orders become confusing. When a resident, for example, goes to the hospital and comes back, it may not be crystal clear what medications they are now to be on. Always contact the resident's primary care provider to ensure that you have a clear understanding of how medications are to be given. Many of our residents see multiple physicians. It's important that you keep all physicians aware of medications that are being prescribed for your resident. Your pharmacy can be a tremendous support to you in accurately delivering medications to your residents. You will want to clearly understand any pharmacy-specific documentation used within your assisted living community. You will want to have the pharmacy telephone number, fax number, and important contact names readily available at all times within your medication work area. We must remember that obtaining medications for the residents is an important part of what we do. When we have new physician orders, they will be sent over to the pharmacy, typically by fax, so that the pharmacy can fill the prescription and deliver it to our community. Whenever a resident is moving into our community, it's very important that the pharmacy receive complete physician orders. We also work with a pharmacy on refilling medication orders. Now we have to remember, pharmacies cannot always instantly refill a prescription. Sometimes the physician must be contacted for approval. If it is an unusual medication, they perhaps may not keep it in stock at all times. So when refilling medications for our resident, it is important that we allow enough lead time for the pharmacy to receive notice of the refill and to get the medication delivered back out to us. Some of your medications will be on what is known as a cycle fill. With a cycle fill, at a predetermined time, your pharmacy will automatically deliver the refills out to you. Remember, if we have an order to give the medication, it is essential that we have the medication available within our community in a timely manner to be able to give it to the resident correctly.
It's my job to make sure that the meds are available and ready to give, so I monitor refills on a daily basis.
If you have ordered a medication and it has not been delivered as expected, remember it is your responsibility to contact the pharmacy immediately for follow-through. Sometimes orders are misplaced or misfiled, or perhaps an order didn't go through the fax as we expected. So always call your pharmacy to ensure that the medication will be delivered in time for you to give to the resident appropriately.
It's very easy for a pharmacy to make a mistake. It's happened to me numerous times. So I make sure if a pill doesn't look right or something just doesn't feel right, to ask questions.
Your pharmacy is also a great resource when something is confusing about a medication or a physician's order or how a resident is to take a medication. Never hesitate to contact your pharmacist for clarification. You will want to take time to familiarize yourself with a variety of physician orders. so that when you are working as a MedAid, you'll feel very comfortable when physician orders are received. Remember, always turn to your supervisor for any questions that you may have.